PCP is a anesthetic that was originally developed in the 1950s to be used during surgery because of its main ability to kill pain. However, along with the ability to kill pain, it brought about a trance-like out-of-body and environment experience that the patients would experience when they were put under. They discontinued using PCP as an anesthetic for surgery in 1965 because while recovering from its anesthetic ability, the patients became agitated, delusional, and irrational. So this led them to believe that it could become a harmful drug, and allowing people to go under it many times if they need surgery could be harmful to them and cause them to become addicted. PCP is a white crystal powder that is easily dissolved in water and alcohol, and you can tell that it's PCP because it has a bitter chemical taste about it. Now it is sold in tablets, capsules, and different colored powders. With the tablets, capsules, and colored powders, you can either smoke it, inject it, snort it, or you can swallow it. Most commonly, it is sold as a powder today or a liquid, and this liquid can be applied to different kinds of leaves. One of the most common leaves that it's applied to is marijuana. So sometimes when people can buy marijuana, the leaf of the plant will be laced with PCP, and unknowingly these people will be ingesting PCP. Some other things besides marijuana can be put on are mint, parsley, and tobacco. So this leads to many people being exposed to PCP and not even knowing what's going into their body because they don't know that it was originally put on these leaves. For low doses of PCP, some short-term effects can be distinct changes in body awareness. Like you see in alcohol, you become wobbly and you know that you're there, but some of the things you say or do aren't things you would normally do. You begin to breathe more shallow. There's flushing, a profuse sweating, a general numbness throughout the body, and it creates poor muscular coordination. If in high doses, the short-term effects you'll see are hallucination, seizures, vomiting, and paranoia. In a high dose, a long-term effect would be death, which can happen if you don't know exactly what sort of PCP you're putting into your body or how much of it you're putting in. PCP is something that can be easily abused if you're not sure how much you're putting in or how often you're taking it. It's not a good drug to experiment with. This can result in dangerous hallucinations coupled with aggressive behavior. Not only does this become a problem for the person who has taken and ingested the PCP, but it also becomes a problem with the people surrounding them and who have to deal and handle with them, because along with their aggressive behaviors, they tend to feel invulnerable and they don't have any concern for causing themselves pain, mostly because it is an anesthetic, so they're not going to feel the pain, and they don't have a concern to cause other people around them pain. Some of these people who are most commonly affected by this are law enforcement officers, doctors, and nurses, and really anybody who's around them. So if a friend's with them or something, they might turn on them and not care if they harm them or aren't listening to them or put them in danger, because at that point in the drug, they have no rational judgment that they can use, and they are willing to harm themselves as well as others. And some long-term effects, if you keep using this drug, would be becoming addicted. There would be a psychological dependence. You would be craving it. You could obtain memory loss, and it can lead to other mood disorders that you could develop. And when you're going through withdrawal, it can occur from the first day of the last use, and it can last up to 3 months. And some of these things that you can experience are depression, anxiety, the violent behavior, and suicidal thoughts. And one of the most critical things in recovery from this drug is to make sure that you remove all the residual PCP that's in the body, because it resides in fatty tissues just like marijuana, and it can pop up again in your body in anywhere from months after to a year after you're finally